Alright team, we have a patient presenting with nephritis, chronic atrophic rhinitis, and reactive gastropathy. What do you think we're dealing with here?
Well, those symptoms could point to a few different conditions. It's a tricky case.
I'm thinking it could be something like lupus or even Wegener's granulomatosis. Those conditions can manifest with similar symptoms.
I'm leaning more towards Sjogren's syndrome or maybe even Goodpasture syndrome.
The symptoms seem to fit better with those conditions.
No. It's retinoblastoma. I have no doubt about it.
Retinoblastoma. But Dr. Hawks, that's a rare eye cancer in children. How can it be related to these symptoms?
I don't care how rare it is. I know what I'm talking about and I've made up my mind. We need to perform an esophagectomy on the patient immediately.
But an esophagectomy is a major surgery. It's a risky procedure, especially if the diagnosis is not accurate.
I'm not sure about this, Hawks. Are you sure about your diagnosis?
Damn it. I said we're doing an esophagectomy and that's final. I won't have any doubts in my team. Get ready to operate.
Hawks, I called you in here because I heard about your plan to perform an esophagectomy on a patient you believe has retinoblastoma. Are you sure about this diagnosis? Have you considered all other options?
Tracy, I appreciate your concern, but I have years of experience in the field. I know what I'm doing and I firmly believe that this is the right course of action for my patient.
I understand your confidence, Hawks, but we need to be absolutely certain before we proceed with such an invasive procedure. Let's discuss this further and consider all possibilities.
I don't need you questioning my fucking judgment, Tracy. I know what I'm doing. Trust me, this is the best way to save my patient.
Hawks, I'm not questioning your expertise. I just want to make sure we explore all options and make the best decision for the patient's well-being. Let's work together on this.
Fine, but just know that I have the patient's best interests at heart. I will prove to you that this is the right course of action.
Shit! The patient's in critical condition. How am I going to break this to Hawks?
The esophagectomy was not the correct treatment for retinoblastoma. I have to find a way to explain this delicate situation without causing more panic.
But Dr. Hawks, we followed the standard procedure for esophagectomy. We did everything by the book.
By the book. You fools don't even know how to read. You chose the wrong procedure and misdiagnosed the patient.
We were just trying our best, Dr. Hawks. We thought we were doing the right thing.
Your best is not good enough. You lot couldn't diagnose a cold if it hit you in the face.
I still think the diagnosis was correct, Dr. Hawks. The symptoms were indicative of that condition.
Indicative. More like irrelevant. You're all a disgrace to this profession.
We are truly sorry, Dr. Hawks. We will do better next time.
Next time? There won't be a next time if you keep up with this incompetence. I'm done with all of you. Figure it out yourselves. I'm out of here. I can't believe we still haven't figured out what's ailing Mrs. Robinson. It's like a medical mystery that's driving me insane.
Well, looks like someone's losing their touch. Maybe you should stick to simpler cases, Hawks.
Ha! Very funny. Just you wait, Johnson. I'll crack this case sooner than you think.
Sure. I'll believe it when I see it, Hawks. Maybe Mrs. Robinson just needs some fresh air or something.
Wait a minute. I think I got it. It's a rare allergic reaction to a medication she's been taking. I need to go check her chart right now. See you later, Johnson.
Hey, wait. You can't just leave me hanging like this, Hawks. Come back.
I know I don't have the proper gear, but I need to talk to you all. Look, retinoblastoma isn't what we are dealing with here.
What do you mean? We already planned the treatment based on that diagnosis.
I've been studying the case extensively, and I'm convinced it's Bietti's crystalline dystrophy. It fits all the symptoms way better.
But that's a rare condition. Are you sure about this?
We can't just switch diagnoses like that. It affects the treatment plan drastically.
Questioning me is how we got here in the first place. Either save the patient's life or start looking for a job you idiots can actually do. Thanks, Tracy. It was a challenging case, but I'm glad we were able to get to the bottom of it.
You did a great job, Hawks. Your dedication and expertise really shine through in this diagnosis.
You know, if you Had just let me have what I wanted from the beginning, we wouldn't have gone through that whole mess with the wrong diagnosis.
What do you mean, Hawks? I'm not sure I follow.
I'm not entirely sure myself, Tracy. But I had a feeling. A gut